peer-reviewed papers. And so I'm very excited to have such a well-known expert with us tonight to talk about his newest role and a new test that his health system is offering called RX Match. So I will let Dr. McLeod take it from here.
Genomics within Intermountain. And it's not usual that a .org is talking about the testing that's available as opposed to a .com. But there's some advantages there in terms of what we're able to do and how we can support things. The panel that we developed here at Intermountain to support the needs throughout our institution has a number of genes on it. There are that are shown here. There are some of them that are the usual suspects, and many of them are important for behavioral health, because that's a big area that we use for both on the pediatric and the adult side. But they also include some elements like DPYD, which is important on the oncology side. This panel, for example, we're going to be using this panel routinely in our medical oncology patients, partly because of DPYD. Certainly that's a good reason to use it, but also because these patients need pain control, they need antidepressants, they need antifungals, they need a lot of the things that we manage, with pharmacogenomics being a contributor. There are elements that talk about things by drug class, and so that can be quite handy for a quick look, where I need to pick an ADHD drug. I can go and just focus down on the green ones. Maybe even not even consider the yellow ones. Yellow, of course, you could use, just monitor a little more carefully. But if you have green and you're used to using it, go green. Don't bother with the yellow is the way we usually practice. There's also some more details in terms of what this means, and so in the case of the anticonvulsants down there's one green and a couple of yellows, and it tells a little bit about what yellow means. Those are very handy for people like yourselves. Less handy for the patient, but they are written for you. They're written for the practitioner to then discuss with the.
Okay, so I have a question. So one of these pharmacists is like, oh my gosh, that's a great panel. It's a great price. I want to work with these guys. What do next steps look like? And what does working with your team look like?
I would say that the starting point is contacting Warner Murphy. Since you're on here, I'll put you on the spot, and then can build from there. Want to make sure that you have kits where you need them, and that you know exactly the process. But if you're interested in this, then it's a case of saying, all right, making sure we can meet your needs, not just the general. I'm working in a lot of different contexts right now, so I have no worries about meeting your needs. But you may need kits in 2 places or something like that. Jennifer, you're going to be practicing in with one location, but maybe you have more. I don't know. So that would be the level of detail then that Warner, or he may pull in Luke or Casey, could talk through and get that going. But really, it's down to the practicalities at that point. Also, they can talk through the way billing needs to be done or whatever, to try to make it so it fits your practice model as best we're able.
Are those kits able to be shipped directly to patients, or do they always come to the provider?
We can do that too. Yep, we can accommodate whatever you would like us to do. We definitely have some cases where we are shipping the kits directly to the patient.
Is it like when we order the kits we pay, or once the test is actually performed and run in the lab? What does that process look like?
There will be no bill sent to either you or depending on how we do this, but depending on whether it goes to you or directly to the patient, there's no bill until after the test is complete. And we have a verified results page, pages. It's about 30 pages long, actually, the test is itself, when it's all completed.
Okay.
And so nobody will get a bill until after that has been completed.
And so that would account for inadequate samples and that sort of thing too.
Yep. You're never paying for kits. We can send you as many kits as you'd like. And so you're not paying anything up front or beforehand. Most of our clinics will usually ask for about 5 to 10 kits just to get them started.